Hello everyone, good evening. We are going to soon start our session with Dr. Gurjot about suicide prevention. We are waiting for a few viewers and the right time to come in, that's 7 o'clock. We'll be starting in just 5 minutes. To all the viewers, if you would like to ask any question, you can definitely put it up in the question and the comments. We will be soon starting talking about suicide prevention, as today is Suicide Prevention Day. And International Suicide Prevention Day is celebrated on the 10th of September. And today we are celebrating this with Rebirth by Counseling, and Dr. Gurjot is here to share his inputs about suicide prevention. We are waiting for Dr. Gurjot to join in, and we will start the session at 7 o'clock. Yes, Dr. Gurjot is already here. Good evening, doctor.
Very good evening. Can you?
I can hear you. Can you hear me?
Yeah, absolutely.
All right, great. I think we'll be soon starting in just about 2-3 minutes. We are having some viewers joining us in. For all the viewers from Instagram and Facebook also, everybody will be joining here on Facebook only. I think you're out somewhere. I mean, you can be without the mask. Is it okay?
Yeah, I'm alone in the OPD right now, so I can be without mask.
Okay.
Yeah. First of all, I would like to thank the entire team of Rebirth by Counseling to invite me about this very, very important topic, that is suicide prevention. And marking this month, the September month is considered as the World Suicide Prevention Awareness. So today, 10th of September is observed as the World Suicide Prevention Day, which is a very important day. And for the awareness of this, I can say it's an epidemic right now. The suicide in itself is an epidemic. Like we are looking at a pandemic all over the world, which is COVID-19. In the similar fashion, suicide is becoming a epidemic because we are looking at a pattern of suicides which are happening there due to various kind of addictions and other mental illnesses. So it's a pattern. It's not a individual.
I totally agree.
Yeah, not an individual thing that somebody is having suicide, and it's a society thing now. So it's a very important topic in today's world. And
like you're thanking Rebirth by Counseling, I think we would also like to thank you to spare this time here, because it is a pressing mental health issue and we're dealing with so many mental health issues here, but suicide is something that is talked about very less. People think that talking about it can actually get more suicidal attempts or get it into somebody's mind. So talking about it today, we just want to spread more awareness. And Rebirth is a portal, counseling portal, wherein we welcome people who are actually feeling or having suicidal thoughts also. We will be talking about Rebirth also maybe very soon. But in this session today, we are going to hear from Dr. Gurjot first about suicide prevention, some statistics about maybe, what is suicide, how suicide is in India. And then we will also move on to how to prevent it. I know many of y'all here as viewers would want to know that kaise isko roka ja sake, how can we stop this suicide? So we will be also discussing about the same. Anything before we start, Dr. Gurjot? Would you like to say anything before I, give your introduction?
Yeah, of course. Okay, I would like to start this by putting some light on the global facts and figures about suicide. So suicide is something which is happening throughout the world, and there is no country which is spared from this. Right now, if we talk about India, 16.5 people are dying because of suicide. as per the population of 1 lakh. So from 1 lakh, there are 16 people who are dying around us because of suicide, which is
Mm-hmm.
a big figure. If
It's
we
a very big
compare it
figure.
with, yeah, if we compare it with the other causes of death, it is the second second leading cause of death among the people aging from 15 to 29. So second means there is just one thing more which causes death among this age group. So it's a huge number. So, so if we look at the news channels and other motivational talks these days, nobody is
Mm-hmm.
talking about suicide. It's a very less talked topic because people
Right.
think that more people will commit suicide by just listening about suicide. It
Right.
is a
And it's a
totally wrong.
myth. It's a myth. That's not a fact that people do, listen about it and then commit it.
Yes. So there is little bit opposite to it. If we talk more about suicide, less people are going to attempt about it
Very true.
because they will be more aware how we can prevent it and what causes it. So again, going to the figures, globally, if we see around 8 lakh people die because of suicide every year, which is like every 40 seconds, one person is dying.
Oh my
So
God.
while we're talking, there will be lot of people who have already committed suicide. So
Right.
it is horrifying if we say it's a horrifying figures. And more, if I go a little deep about the suicide, it is not an illness.
Mm-hmm.
There is a there is a bigger picture behind suicide. It's just an outcome of an illness.
Okay.
So if we look at it, it's just an outcome. Like we can say somebody went through an injury and ultimately got disabled by losing a hand or leg.
Mm-hmm.
So that disability. Or somebody has a heart attack and the person died. So we can't say that uh, death is a illness. In the similar fashion, suicide is not an illness.
Okay.
Illness is addiction, illness is depression, illness is anxiety. And if we see a person having suicide, we can't just say that he had suicide today. The process of suicide, the story behind the suicide is much bigger. It is months and months of um, uh, what we can say
Planning.
sadness,
Okay.
hopelessness,
Mm-hmm.
worthlessness, helplessness, which is there, and nobody around him or her actually addressed that. So that is where we as a society lacking, right?
Right.
So
If I could add in here, I think you told that very rightly that it is not an illness. So, do you mean that it is a symptom of an illness?
more than a symptom, I just told that it's an outcome. It's not even a symptom.
Okay.
Like symptom can be something which a person can feel, but its suicide is nothing that person is feeling. It's just
Mm-hmm.
what person is doing. So
Okay.
it's more of an outcome of a disease and outcome of an illness rather than just saying it's a symptom or sign.
Okay. Okay.
Right. So another thing I would like to add here is
Sure.
about these facts and figures which we just discussed. They are even not close to what is real. Why it is so? Because in much of the world, society is stigmatized and
Mm-hmm.
condemned
Mm-hmm.
in the form of religious and cultural reasons, and also in some countries, suicide in itself is a criminal offense. So
Okay.
you can't just get open with it that okay, I'm having suicidal thoughts
Mm-hmm.
or I am suicide, because
Mm-hmm.
it in itself is so much stigmatized that people are not that comfortable coming out with it,
Yeah. And I
right?
think sharing is the key there. If they are unable to share it to anyone, they are unable to fight with it then.
Yes, you're right. So we can say suicide is a very secretive act.
Uh-huh.
Like nobody tells anyone that I'm going to have
Yeah.
suicide on this date and this day, and which is lacking because the key to prevention is the making people comfortable talking about it,
Mm-hmm.
right? More people are comfortable talking about it, more we can prevent it.
Right.
So it is very, very, very secretive act and surrounded by taboo. and maybe unrecognized, unclassified, and deliberately hidden
Mm-hmm.
uh, records. Like even if someone in the family is knowing about that my child or my brother is suicidal, they are not sharing it with people
Yes,
because
yes. It's a taboo,
they're
like.
very, yeah, they are very shame. They feel shame in telling people that he or she is having suicidal thoughts.
Mm-hmm.
So it is the stigma related to suicide is actually causing the problem,
Okay.
right?
So are you
So
trying to
it
say
is
that
not
the number of attempts are more because it is stigmatized and because people are unable to speak about it also?
very right.
So if
That's what
someone
I
has
want to.
suicidal thoughts and they talk about it, you think they will be able to deal with it better?
Yes.
Okay.
So uh, more if we go more in detail about it, what I want to say is we have to create an environment around the people who are suffering from mental illness or who are already having some issues and going towards the suicide.
Mm-hmm.
We have to create an environment around them so that they can open up, they can talk about it, and they can have the suggestions and kind of help they need uh, for getting out of it, for getting out of that vicious cycle of feeling hopeless and attempting a
Mm-hmm.
suicide and then feeling hopeless, right? So to break it, we need to create us, we all who are fine, who are good at mental health. We are responsible for those people who are thinking of committing suicide, right?
So
So
that
professional
means,
help
sorry
is
to interrupt you again, but so that means that
yes.
not only the mental health professionals, but the community at large can do things also, right?
Yes, so the
Okay.
first line of help is the society and the
Right.
people around that person who is thinking of having a suicide attempt. Professional help is something which comes at the
Later.
last because
Mm-hmm.
nobody can just stand up and tell that, okay, I'm suicidal. I want to see a psychiatrist or a
Agreed,
psychologist.
agreed.
So to share with someone whom they can really trust, whom they can really uh, talk to. So
Right.
people are not giving that openness. People are not that uh, great in talking or in accepting the people as suicidal, right?
Mm-hmm. Like you told, it's not openly discussed. It's not something that, we go around and even check upon people that are you thinking about, attempting a suicide or are you having suicidal thoughts is not a question that many of us as, as a community, as a society even thinks about.
Yeah, that's what I want to try. I was trying to say. And also, there is another thing which I would like to tell is uh, as a society, we are not ready to see our loved ones uh, suicidal and mentally ill. We don't want to accept that,
Okay.
okay, how can my brother or my sister or my child can
Yeah.
be depressed and can think of having suicide? They are in denial. Most of us are in denial. Like
True.
what what the problem the most important problem with a mentally ill person is that he or she will never ever try to, right? So if there is just one person with them who can just uh, tell them to take a professional help or tell them to move one step forward towards a professional help, they can be safe.
Right.
That's all they need. Yeah.
So you mean as a society, they must, when somebody comes to you as a person and somebody confronts to you that I am thinking about anything of about having suicidal thoughts like dying or wanting to die or not wanting to live, then it is the responsibility of the layman to actually guide them through कि आप help ले सकते हैं, आप professional help ले सकते हैं. Correct.
Yes. So that's very important as a society. That is very important, and as a person who is thinking of suicide or who is going to attempt for suicide and may have attempt and nobody is knowing. there are some vital signs which we can see,
Okay.
uh, we can see passively, and that is also important to identify that if that whether someone is really going to be suicidal or something. We can identify it. Even a person who is not very trained about the psychological uh, studies and skills,
Mm-hmm.
that person can identify. It's very simple. Like if we can see that person is not talking much, most of the time the person is staying in the room and away from the
Like
family.
isolating and withdrawing themselves from the public.
Yeah, isolating and withdrawing themselves from the family specifically.
Mm-hmm.
Maybe people are introvert and they are not that comfortable with the normal public, but if they are not interacting with the family and isolating themselves from the family, that is a big positive in the direction of that he or she may be thinking of something.
Right. A very big sign, you mean? Yeah.
Yeah. So other thing is you can look for some physical signs like some hesitancy cuts on the arms, that is suicidal cuts,
Okay.
and which people usually make when they are not having that much courage to cut their
Mm-hmm. So that,
try to they just try to make an attempt to kill themselves.
so like
So
self harm. You're talking about anything that comes under self harm. Okay.
self harm, yeah. So these signs can be seen in the form of hesitancy cuts, or in the form of sometimes some people just try to strangulate themselves and there are marks on the neck which
Mm-hmm.
have no uh, uh, the person is not able to tell you how specifically they came. So
Yeah.
these kind of suspicious signs can be seen by the people around them and can be reported to the professional,
Right.
and which can actually save lives.
Correct. I know some of the teenagers who, always would wear full sleeves just to hide those marks on their forearms. And that's also a very big sign when you consistently always see someone hiding some part of their body just because they want to hide the self harm. So we can be very careful at times when something like this is a consistent, persistent, action by somebody.
Yes. Yeah. So we need to be careful about these. And also other signs like people may slip conversations of suicide plans
Okay.
while talking to their friends and family. We should not take them lightly. We should not just laugh at them and that you are going to you are going to attempt suicide or something. Like we just laugh it out sometimes,
Right, right.
and we should take it seriously. Like if they are talking about suicide, okay, she may sometime in the future can attempt it. So we should take it seriously and talk about it with the person, or we should just go to a professional to
Who can
know
guide and
that
help
what.
us in this matter.
Yeah, it really means that my friend is talking like this and he's saying that I just want to jump in front of train,
Yeah.
and I don't know if he's serious or not. So the professionals can tell more. So we should always contact professional and never hesitate to talk to a professional. Like in India, I think India's psychiatry and psychology is being taken very lightly, and people think that it's not required until somebody is out of their mind and just
Right, right.
pulling their hair, or just getting out of the house and running around here and there. That is the point when people come to us. So that is the point when illness has already been set up, right? That is not the right time to come to us. The
Correct.
right time to come to us is when the person is at risk, when the person is in the going in the direction of setting into illness.
Hmm. The
That is the point.
onset, like when it just began.
Yeah, that is the point when we can just talk to the person and just get stop the entire process of getting ill and thinking of suicide.
Yeah, and have a control over it at the right time and just the beginning. And I'm sure you'll
Yeah,
agree to this, that if you deal with something when it starts, it's better to handle it than when, you know, it has reached to another level, when it becomes difficult to really manage the entire situation also.
yeah, that's very true. Like there are a few indirect signals, like if a person is drinking very heavily, or drinking in during the daytime, or drinking and driving. So most of the people just say that he's careless or he's just out of his mind. So
Okay,
that is not how we can define a person
right.
sanity, right? So in a way, that person is trying to kill himself. That person is not worried about getting hurt by accident, or by physically getting harmed by drinking so much of alcohol.
Bilkul.
So see, if we go to a professional, the professional can just take the deep meaning, or the meaning
Find out
behind.
the underlying cause maybe about these thoughts.
Yeah.
I'm
So
sorry,
in a
I'm
way,
just interrupting. There is a little bit of a request that thoda Punjabi che bhi naal naal tusi bolde raho. So we'll have a mix of English, Hindi and Punjabi so the viewers can also understand it. Also, if someone has any question, whether Punjabi che puchna hai, agar aapko Hindi mein puchna hai, or if you want to ask in English, please comment with your question. I will be taking up questions towards the end of the session. Sorry, yeah, you can continue. So the
okay. So
professional can find out an underlying cause, is what you were saying.
yeah, so Gurpreet Singh Sandhu just requested us to have a conversation in Punjabi. So ਮੈਂ ਚਾਹਾਂਗਾ ਕਿ ਮੈਂ ਆਪਣੇ viewers ਨੂੰ summarize ਕਰਾਂ 2 ਤੋਂ 3 ਮਿੰਟ ਦੇ ਵਿੱਚ
Sure,
quickly ਜੋ ਆਪਾਂ ਗੱਲ ਕੀਤੀ ਹੈ ਪੰਜਾਬੀ ਦੇ ਵਿੱਚ, ਕਿ ਸੁਸਾਈਡ ਕੀ ਹੈ। ਸੁਸਾਈਡ ਇੱਕ ਆਊਟਕਮ ਹੈ, ਸੁਸਾਈਡ ਇੱਕ ਬਿਮਾਰੀ ਨਹੀਂ ਹੈ। ਸੁਸਾਈਡ ਬਿਮਾਰੀ ਦਾ ਅੰਤ ਹੈ। ਜਦੋਂ ਉਹ ਬਿਮਾਰੀ ਖਤਮ ਹੁੰਦੀ ਹੈ, ਤੇ ਜਿਵੇਂ ਹਾਰਟ ਅਟੈਕ ਦੇ ਵਿੱਚ ਬੰਦਾ ਮਰਦਾ ਹੈ, ਉਵੇਂ ਸੁਸਾਈਡ ਡਿਪਰੈਸ਼ਨ ਦੇ ਵਿੱਚ ਬੰਦਾ ਸੁਸਾਈਡ ਨਾਲ ਮਰਦਾ ਹੈ। ਸੋ ਆਪਾਂ ਨੂੰ ਅੰਤ ਕਹਿ ਸਕਦੇ ਹਾਂ, ਬਿਮਾਰੀ ਦਾ ਕੋਈ ਸਾਈਨ ਜਾਂ ਸਿੰਪਟਮ ਨਹੀਂ ਕਹਿੰਦੇ, ਜਾਂ ਬਿਮਾਰੀ ਨਹੀਂ ਕਹਿੰਦੇ, ਉਹ ਇੱਕ ਅੰਤ ਹੈ। ਦੂਜੇ ਨੰਬਰ ਤੇ ਆਪਾਂ ਗੱਲ ਕੀਤੀ ਸੀ ਕਿ ਦੁਨੀਆ ਦੇ ਵਿੱਚ ਜਿਹੜੀ ਸੁਸਾਈਡ ਹੈ, ਉਹ ਬਹੁਤ ਜ਼ਿਆਦਾ ਵਰਲਡ ਦੇ ਹਰ ਕੰਟਰੀ ਦੇ ਵਿੱਚ ਹੈ, ਔਰ ਬਹੁਤ ਜ਼ਿਆਦਾ ਤੇਜ਼ੀ ਨਾਲ ਵੱਧ ਰਹੀ ਹੈ। ਜੇ ਆਪਾਂ ਇੰਡੀਆ ਦੀ ਗੱਲ ਕਰੀਏ, 16 ਲੋਕੀ 1 ਲੱਖ ਪਿੱਛੇ 16 ਲੋਕੀ ਸੁਸਾਈਡ ਕਰਦੇ ਨੇ। 16 ਦਾ ਫਿਕਰ ਬਹੁਤ ਵੱਡਾ ਹੈ। ਜੇ
yes,
ਆਪਾਂ
of
ਗੱਲ
course.
ਕਰੀਏ ਕਿ ਟੈਰਰਿਸਟ ਜਿਹੜੇ ਟੈਰਰਿਸਟ ਅਟੈਕ ਦੇ ਵਿੱਚ ਲੋਕੀ ਮਰਦੇ ਨੇ, ਜਾਂ ਵਾਰ ਦੇ ਵਿੱਚ ਮਰਦੇ ਨੇ, ਉਹ ਵੀ ਸਾਰਾ ਦਿਨ ਸਾਡੇ ਨਿਊਜ਼ ਚੈਨਲ ਗੱਲ ਕਰਦੇ ਆ ਕਿ ਪਾਕਿਸਤਾਨ, ਚਾਈਨਾ, ਜਾਂ ਵਾਰਫੇਅਰ, ਜਾਂ ਟੈਰਰਿਸਟ ਅਟੈਕ, ਜਿਹਦੇ ਬਾਰੇ 24 ਘੰਟੇ ਗੱਲ ਹੁੰਦੀ ਹੈ, ਉਹਦੇ ਨਾਲ ਵੀ ਘੱਟ ਲੋਕੀ ਮਰਦੇ ਨੇ ਜੇ ਉਹ ਆਪਣੇ ਟੀਵੀ ਦਾ 2 ਘੰਟੇ ਦਾ ਟਾਈਮ ਸੁਸਾਈਡ ਬਾਰੇ ਅਵੇਅਰ ਕਰਨ ਤੇ ਲਾਣ, ਤੇ ਸ਼ਾਇਦ ਆਪਾਂ ਬਹੁਤ ਸਾਰੀਆਂ ਮੌਤਾਂ ਨੂੰ ਬਚਾ ਸਕਦੇ।
I think, yeah,
राइट
that's a very nice point कि अगर मीडिया इस चीज़ ਨੂੰ सीरियसली लाए और अवेयरनेस स्प्रेड करे, जिस तरह से हम एक छोटे बहुत ही छोटे कम्युनिटी चे ट्राई कर रहे हैं that we can reach out to others and make them understand about suicide. If what you're trying to say is if the news channel or media or influencers start to do it, I think उसका impact बहुत अच्छा रहेगा. I totally agree.
ਯੈਸ। ਐਂਡ ਗਲੋਬਲੀ ਆਪਾਂ ਦੁਨੀਆ ਦੇ ਲੈਵਲ ਤੇ ਗੱਲ ਕਰੀਏ ਤੇ 8 ਲੱਖ ਲੋਕੀ ਹਰ ਸਾਲ ਸੁਸਾਈਡ ਕਰਕੇ ਮਰਦੇ ਨੇ, ਤੇ ਖੁਦਕੁਸ਼ੀ ਕਰਕੇ ਮਰਦੇ ਨੇ, ਜਿਹਦਾ ਮਤਲਬ ਹੈ ਕਿ ਹਰ 40 ਸੈਕਿੰਡ ਦੇ ਵਿੱਚ 40 ਸਕਿੰਟਾਂ ਦੇ ਵਿੱਚ ਇੱਕ ਬੰਦਾ ਆਪਣੀ ਜਾਨ ਸੁਸਾਈਡ ਦੇ ਨਾਲ ਦਿੰਦਾ, ਜਿਹੜਾ ਕਿ ਅਗੇਨ ਇੱਕ ਬਹੁਤ ਅਲਾਰਮਿੰਗ, ਬਹੁਤ ਹੀ ਜ਼ਿਆਦਾ ਖਤਰੇ ਵਾਲੀ ਗੱਲ ਹੈ।
Correct.
ਠੀਕ, ਇਹ ਆਪਾਂ ਹੁਣੇ ਥੋੜੀ ਦੇਰ ਪਹਿਲਾਂ ਇੰਗਲਿਸ਼ 'ਚ ਕੀਤੀ ਸੀ। ਦੂਸਰੀ ਗੱਲ ਆਪਾਂ ਜਿਹੜੀ ਹੁਣ ਸਾਨੂੰ ਪੰਜਾਬੀ 'ਚ ਗੱਲ ਕਰ ਰਹੇ ਹਾਂ, ਤੇ ਪੰਜਾਬੀਆਂ ਨੂੰ ਇਸ ਚੀਜ਼ ਦੀ ਹੋਰ ਜ਼ਿਆਦਾ ਲੋੜ ਆ ਚੰਗੀ ਤਰ੍ਹਾਂ ਸਮਝਣ ਦੀ। Okay, so few of our
They want us
viewers
to go online on Instagram.
Instagram. So ਆਪਾਂ Instagram ਲਾਈਵ ਵੀ ਕਰਾਂਗੇ, ਜਲਦੀ ਕਰਾਂਗੇ
Sure, soon.
ਕਿਸੇ ਦਿਨ। Yeah. So ਪੰਜਾਬੀ ਦੇ ਵਿੱਚ ਪੰਜਾਬੀਆਂ ਦੇ ਲਈ ਜ਼ਰੂਰੀ ਕੀ ਹੈ? ਸਟਿਗਮਾ ਮਤਲਬ ਕਲੰਕ। ਠੀਕ ਹੈ, ਤਾਂ ਪੰਜਾਬੀ ਦੇ ਵਿੱਚ ਜੇ ਆਪਾਂ ਗੱਲ ਕਰੀਏ ਕਿ ਸਾਡੇ ਲੋਕੀ ਸੁਸਾਈਡ ਦੇ ਬਾਰੇ ਗੱਲ ਕਰਨਾ ਇਦਾਂ ਸਮਝਦੇ ਨੇ ਜਿੱਦਾਂ ਆਪ ਕਰ ਰਹੇ ਆ। ਜੇ ਕੋਈ ਘਰ ਦੇ ਵਿੱਚ 3 ਬੰਦੇ ਲੋਕੀ ਬੈਠ ਕੇ ਗੱਲ ਕਰਨ ਕਿ ਉਹਨੇ ਸੁਸਾਈਡ ਕਰ, ਤੇ ਸਾਡੇ ਮਾਤਾ ਜੀ ਜਾਂ ਸਾਡੇ ਤੋਂ ਪਹਿਲੀ ਜਨਰੇਸ਼ਨ ਜਿਹੜੀ ਉਹ ਕਹਿਣਗੇ ਕਿ ਇਹ ਸ਼ਬਦ ਨੂੰ ਨਾ ਬੋਲਿਆ ਜਾਵੇ, ਕਿ ਸ਼ਾਇਦ ਬੋਲਣ ਦੇ ਨਾਲ ਹੀ ਸਾਡੇ ਘਰ 'ਚ ਸੁਸਾਈਡ ਨਾ ਹੋ ਜਾਏ। ਤੇ
ਕਰੈਕਟ
ਇੰਨਾ
ਕਰੈਕਟ।
ਜ਼ਿਆਦਾ ਸਟਿਗਮਾ ਇਹਦੇ ਨਾਲ ਰਿਲੇਟਡ ਹੈ ਸਾਡੇ ਪੰਜਾਬ ਦੇ ਵਿੱਚ।
तो जिस तरह ਤੁਸੀਂ ਪਹਿਲੇ ਗੱਲ ਕਰ ਰਹੇ ਸੀ ਅਬਾਊਟ ਟੈਬੂ, ਮਤਲਬ ਇਤਨਾ ਜ਼ਿਆਦਾ ਟੈਬੂ ਹੈ ਕਿ ਤੁਸੀਂ ਇਸ ਬਾਰੇ ਗੱਲ ਵੀ ਨਾ ਕਰੋ ਤੇ ਵਰਡ ਵੀ ਨਾ ਯੂਜ਼ ਕਰੋ। ਆਈ ਐਗਰੀ ਟੂ ਦੈਟ। ਜਸਟ ਵਾਂਟਿੰਗ ਟੂ ਐਡ ਵਨ ਮੋਰ ਥਿੰਗ, ਗੁਰਪ੍ਰੀਤ ਸਿੰਘ ਤੁਹਾਡੇ ਜੇ ਕੋਈ ਇੰਸਟਾਗ੍ਰਾਮ ਤੇ ਵੇਟ ਕਰ ਰਿਹਾ ਹੈ, ਪਲੀਜ਼ ਐਡਰੈਸ them to come on Facebook because ਅਸੀਂ Facebook ਲਾਈਵ ਕਰ ਪਾਏ ਹਾਂ। So just requesting that for the viewers on Instagram. ਹਾਂਜੀ, ਕੰਟੀਨਿਊ
ਜੀ ਸਰ। ਕੰਟੀਨਿਊ ਕਰਦੇ ਹੋਏ ਜਿਹੜਾ ਇਹੀ ਸਟਿਗਮਾ ਆ ਸਾਨੂੰ ਲੋਕਾਂ ਨੂੰ ਹੈਲਪ ਲੈਣ ਤੋਂ ਰੋਕਦਾ ਹੈ। ਕਿਵੇਂ ਹੈਲਪ ਲੈਣ ਤੋਂ ਰੋਕਦਾ ਹੈ? ਮੰਨ ਲਓ ਕਿ ਇੱਕ ਮੁੰਡਾ ਆ ਜਿਹਨੂੰ ਕਿ ਸੁਸਾਈਡ ਕਰਨ ਦਾ ਮਨ ਹੋ ਰਿਹਾ, ਉਹਨੂੰ ਸੁਸਾਈਡ ਕਰਨ ਦਾ ਮਨ ਹੋ ਰਿਹਾ ਹੈ, ਉਹਦੀ ਕੋਈ ਆਪਣਾ ਕੰਟਰੋਲ ਨਹੀਂ ਹੈਗਾ ਕਿ ਉਹ ਜਾਣ-ਬੁੱਝ ਕੇ ਸੁਸਾਈਡ ਕਰ ਰਿਹਾ। ਉਹਦੀ ਕੋਈ ਬਿਮਾਰੀ ਹੈ, ਉਹਦੇ ਪਿਛਲੇ ਪਾਸੇ ਹੈਲਪਲੈਸਨੈਸ ਹੈ, ਨਿਰਾਸ਼ਾ ਹੈ, ਜਿਹਦੇ ਕਰਕੇ ਉਹ ਸੁਸਾਈਡ ਵੱਲ ਜਾ ਰਿਹਾ। ਹੁਣ ਪੁਆਇੰਟ ਕੀ ਹੈ ਕਿ ਸੁਸਾਈਡ ਕਰਨ ਦੇ ਦੌਰਾਨ ਉਸ ਸਮੇਂ ਦੇ ਵਿੱਚ ਇਸੇ ਸਟਿਗਮਾ ਕਰਕੇ, ਇਸੇ ਕਲੰਕ ਕਰਕੇ ਜਿਹੜੇ ਲੋਕੀ ਚਾਹੁੰਦੇ ਆ ਕਿ ਆਪਾਂ ਸੁਸਾਈਡ ਬਾਰੇ ਗੱਲ ਨਾ ਕਰੀਏ, ਉਹ ਕਿਸੇ ਦੀ ਮਦਦ ਨਹੀਂ ਲੈ ਪਾਉਂਦਾ, ਨਾ ਆਪਣੇ ਘਰਦਿਆਂ ਦੀ, ਨਾ ਪ੍ਰੋਫੈਸ਼ਨਲ। ਸੋ ਇਹ ਜਿਹੜੀ ਰੋਕ ਆ, ਜਿਹੜੀ ਇਹ ਆਪਾਂ ਸਾਰੀ ਸੁਸਾਇਟੀ ਨੇ ਰਲ ਕੇ ਲਾਈ ਹੋਈ ਆ, ਸੁਸਾਈਡ ਕਰਨ ਵਾਲੇ ਲੋਕਾਂ ਨੂੰ ਗੱਲ ਕਰਨ ਤੋਂ ਰੋਕਣ ਤੇ ਆਪਾਂ ਰੋਕ ਲਾਈ ਹੋਈ ਹੈ। ਉਹ ਰੋਕ ਹੀ ਜਿਹੜੀ ਆ ਇਸ ਪ੍ਰੋਬਲਮ ਤੋਂ ਬਚਣ ਦਾ ਸੋਲੂਸ਼ਨ ਨਹੀਂ ਦੇ ਪਾ ਰਹੀ ਸਰ। ਇਸ ਪ੍ਰੋਬਲਮ ਵੱਲ ਹੋਰ ਖਿੱਚ ਰਹੀ ਹੈ ਲੋਕਾਂ ਨੂੰ। ਸੋ ਜਿਹੜਾ ਬੰਦਾ ਬਚ ਸਕਦਾ ਸੀ ਉਹ ਨਹੀਂ ਬਚਿਆ। ਕਿਉਂ ਨਹੀਂ ਬਚਿਆ? ਸਾਡੇ ਸਾਰਿਆਂ ਕਰਕੇ। ਆਪਾਂ ਨਹੀਂ ਉਹਨੂੰ ਉਹ ਕੀਤਾ ਗੱਲ ਕਰਨ ਲਈ। ਕਿਉਂ ਨਹੀਂ ਕੀਤਾ? ਆਪਾਂ ਮਾਹੌਲ ਇਦਾਂ ਦਾ ਕ੍ਰੀਏਟ ਕੀਤਾ ਹੋਇਆ ਕਿ ਤੂੰ ਸੁਸਾਈਡ ਬਾਰੇ ਗੱਲ ਨਹੀਂ ਕਰ ਸਕਦਾ। ਜਾਂ ਜਿਵੇਂ ਮੈਂ ਹੁਣੇ ਥੋੜੀ ਦੇਰ ਪਹਿਲਾਂ ਕਿਹਾ ਕਿ ਕਈ ਲੋਕੀ ਅੱਜ ਕੱਲ ਦੀ ਜਨਰੇਸ਼ਨ ਇਦਾਂ ਆ ਕਿ ਜੇ ਗੱਲ ਕਰਦਾ ਹੈ ਤੇ ਉਹਨੂੰ ਹਾਸੇ ਵਿੱਚ ਪਾ ਦਿੰਦੇ ਆ ਕਿ ਸ਼ਾਇਦ ਇਹ ਮਜ਼ਾਕ ਕਰ ਰਿਹਾ।
So they are not sensitive. You mean ਅਸੀਂ sensitive ਨਹੀਂ ਹੁੰਦੇ towards these topics?
ਤੇ ਇਹ ਸਾਰੀਆਂ ਜਿਹੜੀਆਂ ਗੱਲਾਂ ਨੇ ਇਹ ਸਾਡੇ ਸੁਸਾਇਟੀ ਵਿੱਚ ਜਿਹੜਾ ਅੱਜ ਇਸ ਮਹੀਨੇ ਦੀ ਸੋ vice and versa ਚੱਲ ਰਿਹਾ, so they just want it in English also.
Right, we will be including English and Punjabi and Hindi, all of it, and we'll be quickly doing the transition, not take too long.
What we talked previously, we are just translating that in Punjabi right now, and we will continue in English again and brief everything in Punjabi and Hindi, right? So ending the conversation Punjabi ਵਾਲਿਆਂ ਲਈ, so ਇੱਕ ਵਾਰੀ ਫਿਰ ਮੈਂ ਦੱਸਦਾ ਕਿ ਇਹ ਇੱਕ ਆਊਟਕਮ, ਇੱਕ ਅੰਤ ਆ ਕਿਸੇ ਵੀ ਮਾਨਸਿਕ ਬਿਮਾਰੀ ਦਾ ਅੰਤ ਆ। ਬਹੁਤ ਸਾਰੇ ਲੋਕੀ ਇਹਦਾ ਸ਼ਿਕਾਰ ਹੋ ਰਹੇ ਆ ਤੇ ਆਪਾਂ ਐਜ਼ ਸੁਸਾਇਟੀ ਇਹਨੂੰ ਰੋਕਣ ਦੀ ਬਜਾਏ ਹੋਰ ਵਧਾ ਰਹੇ ਆ। ਕਿੱਦਾਂ ਵਧਾ ਰਹੇ ਆ? ਕਿਉਂਕਿ ਆਪਾਂ ਕੰਫਰਟੇਬਲ ਨਹੀਂ ਕਰਦੇ, ਇੱਕ এনवायरमेंट ਨਹੀਂ ਦਿੰਦੇ ਲੋਕਾਂ ਨੂੰ ਤਾਂ ਕਿ ਉਹ ਇਹਦੇ ਬਾਰੇ ਗੱਲ ਕਰ ਸਕਣ ਤੇ ਇਹਦੇ ਬਾਰੇ help ਲੈ ਸਕਣ।
Great. And when you're talking about environment, I think non-judgmental environment is something that we are speaking about, ਜਿੱਥੇ judgment ਕਰਕੇ ਨਹੀਂ ਸੁਣ ਰਹੇ ਆ ਲੋਕ। ਜਦ ਕੁਝ ਬੋਲਦੇ ਨੇ ਉਹਨਾਂ ਨੂੰ just as a listener, purely listening to them, actively listening to them is important. Wherein our judgment comes in, things just go out of hand. They will never ever come back and talk to you. So as a layman or as a society, as a community, we have to be good listeners. If somebody is talking about it, be sensitive enough to listen to them. Yes, Dr. Gurjot, right. I think we can move to English now with what you told in the last half.
Like ma'am told, it's a feedback phenomenon. Like if you judge someone, they simply stop talking. That's how our mind works. Like if I'm not like people are not listening to me without getting the real meaning what I'm saying, so yes. I will not tell whatever is in my mind. So that's how it works. So the phenomena itself stops people from talking, right? So over time it becomes.
And I think one incident wherein one time also wherein I get the courage and talk to someone and that person stops it, I think I will never ever go and talk to anybody else even if I'm having those thoughts and I really want to express, because one time somebody did not encourage me. So yeah, yes. as society, we must listen to them.
So that's where these programs like this awareness month, why this is required. This is required because we want to aware people, as many as people who can just ultimately contribute to the process of non-judgmental listening. So if they know what exactly suicide is, how suicide happens, what are the contributing factors, that knowledge in itself make them non-judgmental.
Yeah,
So
and
that
it
is
can
why
help
we need to
prevent the suicides in the future.
have. Yes. So I have a very important this formula, I can say,
Okay.
which makes the societal complex and turn a very normally depressed person to the suicidal attempt or suicide.
Okay.
Right. So what is the combination of factors? We can I've just listed it so that I can't I can go through
Sure,
all of
please,
them.
please.
Yeah. So first of all, what we need, if somebody is suicidal, the first thing we need is the mental illness itself. There is always a underlying mental illness. It can
Okay.
be depression, it can be anxiety, it can be pre-psychotic, it can be any illness. It can be
Mm-hmm.
grief. There are a number of mental illnesses. Even the insomnia can lead to suicide ultimately. So there is a mental illness, underlying mental illness, first thing. Secondly, there is poor coping skills. The person is not able to cope. Like most of the times, people who get depressed, they are
Mm-hmm.
able to resolve their own issues by talking to them, by rationalizing, by taking help from religious this interaction,
Yeah.
by talking to friends. There are a number of coping skills, but the people who ultimately end up in suicide, they have very poor coping skills. The third thing which they lack is social support. Most of the time they are introvert, or they are not that well accepted by the society.
Mm-hmm.
So they lack that social support in the form of family, friends, and people who can they talk to,
Right.
right?
And
So
I think social
fourth,
support plays a very important role for any mental illness, I would say, because if you have a strong social support of family and friends list, I mean, people, group of people who can look after you, I think you feel more cared, more secure, and the action is taken up very soon. You have people to push you to go to a professional. You have people who will, make sure that you're taking the right medicines, the right help that is needed to you. So yeah, like you told, the third point of social support, I think it plays a role. And why am I emphasizing on it today is because all of us are a part of the social support. If we can be
yes.
one social support group for our loved ones, I think we are doing our bit in the society then.
Yeah, exactly, Aman. I agree with you totally. Like we can just simply, I would like to add one thing,
Yeah,
that
sure.
it affects the outcome rather than illness itself, because nobody can stop from getting ill. Like depression is
Correct.
something which nobody will stop by just having social support. Yeah,
Correct.
there can be reduction in the depression cases, but ultimately the outcome of any disease can be altered by having social support.
Very, very
Definitely, it.
true. Very well said. I think this is a very big takeaway. The outcome can be altered. I mean, we can't stop the illness, but we can definitely help them get the treatment and, deal with it or manage it in a better way. And we all don't want the outcome it to be like this. Suicide is never an option, like we say.
Yes. Yeah. So coming to the fourth point,
Sure.
assess to the ways of harming oneself, and like the various ways that someone can attempt suicide. The assess to that ways in itself can lead to the suicide,
Okay.
because sometimes, like in Punjab, why most of the cases we see is sulfas poisoning. Sulfas is a medicine which we keep in kanak, but we can say wheat.
Mm-hmm.
Wheat to preserve wheat, we keep tablets of sulfas in the wheat, and that is very easily accessible to everyone in Punjab.
Okay.
So accessibility to a way which can uh, actually kill you is in itself a very important factor in society. Enumerating again, underlying mental illness, poor coping skill, lack of social support, and access to various ways of harming oneself. These
Mm-hmm.
are the four factors which contribute to the to the person's suicide attempt and suicide itself.
Right.
And anywhere, if we interrupt at any point of time, anywhere, if we increase the coping skills, if we give social support, if we stop the access to the suicidal material,
Right.
or we treat the mental illness, suicide can be prevented. It's very easy if we take the right way.
Correct. I think what you're hinting here is on being responsible. So if you're responsible enough to maybe at a home wherein I know my child, my anyone in my house is going through depression, keeping a check on the kind of knives, kind of ropes that I have at home, keeping a check on the tools that can be used to attempt or commit suicide is what I think we should be very careful of. So people who are caregivers to depressed or having someone having a mental illness, you can be more careful, you can be more responsible towards these things.
Yes. So there are a few other things which I would like to discuss,
Sure.
like what are the suicide triggers? Like if a person has gone through everything, like we can say, what is the last push? These are the last pushes which people get to suicide. Like if the person is already having a underlying mental illness,
Right.
poor coping skills, what we discussed already, the 4 points, then what is the last push? There are few we can discuss, like poverty in itself, ultimately when person is like hopeless from everywhere, and if there is poverty, that can trigger it. And unemployment, if the person is not engaged into something or not going to work every day and not earning, he or she may feel that he or she is burden on this society, and a lot a very complex thought process can be
Yeah.
there, which can which can just push the person to go for suicide. uh, Other thing is loss of loved ones, like in the immediate past, if there is any loss of loved one in the form of mother or boyfriend or girlfriend or wife, anybody can be your loved one, so that can also trigger the suicide process. And an argument, a simple argument with someone can lead to suicide. Like if
Mm-hmm.
the person is almost on the edge and you have a argument with someone,
So it
that can lead to
triggers.
triggers your process of suicide. And last but not least, any work related or legal problem to society. So these factors have been study based, and they have been reported by WHO, the triggers for suicide, which most of the people who before dying, they talked to the psychologist or psychiatrist. They told that these were the points which really pushed us for making such a big decision. Like we were doing fine even with the illness and
Mm-hmm.
everything. These are the particular things which most of the time people have in their life, which go through suicide or suicide attempts. So we
Okay.
need to be careful about these things. If we have someone suicidal around us, so these things should be taken care of.
Absolutely. And I think also many of them ask me sometimes that why did it happen? Like, couldn't we save it? Couldn't we do anything in this place? So there is a lot of I would say nirasha जिसको बोलते हैं या sadness which the others also feel when any such event or act happens, because जब ऐसा कुछ होता है तो हमें सबको बुरा लगता है that हम कुछ नहीं कर पाए. So rather than why is it called prevention day, because rather than regretting about it, let's try and prevent it, let's take some measures to prevent it.
Yeah. So talking about the psychotherapy aspect, or
Yes.
how can we just talk to the person? I think you can tell better because I'm a psychiatrist and you are a psychologist, and you talk to people and you just talk them out of suicidal thoughts, and
Right.
that is something which you are better from me.
Sure.
Like I would like you to tell people that what exactly we can do at a very narrow window of time where somebody is suicidal and thought about it and ready to go for it.
Yeah.
What exactly we can do there?
Right. So I think the first step is when somebody tells you, I mean, as a psychologist, also, when someone comes and tells that it's very difficult to live, very difficult to live. So my question, or I have a direct question to them, that have you ever thought of committing or attempting a suicide, or have you ever thought of dying? And usually, I must tell you, more than 70% of the times, the answer is yes. That at one point of time, I did think about it. Then my next question goes on to what have you planned? Do you have a planning in mind? Because I think when somebody is on the planning stage, that is much more closer to, it's much more serious then. Again, usually I have people saying that they have not really planned it. That means there is a good window to, save them from this entire episode of suicidal thoughts. And then my attention goes on to working on their suicidal thoughts. Now, suicidal thoughts are some thoughts and feelings of hopelessness or questioning their own existence and wanting to not live in this life. So I think I usually start with addressing the problem issue of where is it all coming from? From what kind of a problem do you think you should end your life? Then I try and shift their attention from the attempting of suicide to what is the situation, what is the way that we can handle the situation better. I also introduce a lot of coping statements, and let me do that with all of you here also. What are coping statements? Coping statements are some affirmative sentences or some thoughts that we can tell to our own self in order to reduce our suicidal thoughts or reduce our negative suicidal thoughts. Coping statements like, and you would agree to me, if somebody wants to really attempt suicide, they have this feeling of not ending their life but ending the pain. So a statement which would say that I don't want to end my life but I want to end the pain. A statement which will probably say that this is work in progress, I am work in progress, we are slowly moving there, let me take one day at a time. And a very important part here is that we use the mental filter. When I say mental filter, इसका मतलब है कि हम अपने पॉजिटिव चीज़ें या अपनी अकम्पलिशमेंट्स को भूल जाते हैं, पर हम हमारी नेगेटिव चीज़ें या नेगेटिव सिचुएशंस को बहुत ज़्यादा फोकस करके अपने ध्यान में रखते हैं. And that time what happens is we don't know what good we have done and we feel, oh God, I have not achieved anything in life. So here another intervention that I do with my clients is I ask them to make a list of their accomplishments. अपने जो भी चीज़ें अचीव करी हैं उसकी एक लिस्ट बनाओ, उस चीज़ को अपने पास रखो, maybe make it a wallpaper on your phone or have it somewhere readily available so you can read and you can understand that yes, I have done all of these things and today's situation is different but I know I will come out of this situation too. Many times people tell me नहीं मैंने तो कुछ अचीव किया ही नहीं है, मैंने सच में लाइफ में कुछ नहीं किया है. At that point of time, I usually ask them to go back to their family, friends, their teachers, ask them that, what do you think I've done in my life? And I'm sure if somebody comes and asks this to us, we will point out some positive aspects of that person's life. So I think just to give a gist of these pointers, listing their accomplishments, using affirmative sentences or coping statements, and directly asking them the question, directly asking them to confront. Again, one more thing that I can add is if that's an urgent case, I don't wait too much. You really need to at least pull them down to some helpline, to an organization which can help them, or to psychiatrists who can provide them medicines. I think that's the next stage if it is a very, very serious case. And I think you will also agree to it that if somebody comes to you referred for a suicidal thought or having a suicidal thought, what is the next step that you would take it over?
All right. So uh, I think you explained it very
Thank you.
nicely, and there is left to tell. But to summarize it, I would like to tell everyone that we are addressing three things here. One is hope, second is help, and third is worth. So as Aman already explained that tell the person to filter the positive things. Why the person is worthy to live. So that is worthlessness, killing the worthlessness. And second thing was to make the person feel that there is help available. So that is helplessness, cutting off the helplessness thing. And the third one was hopelessness. So mostly people are hopeless about the negative, all the negative things going into their mind. So
True,
one
very
one should
well.
tell.
I think you summarized it very well. These are three main aspects of suicide and how to prevent it. We cut off on these three areas. Absolutely.
Yeah. just telling them to talk to themselves and have a self talk, so that they can become more hopeful about living, rather than just all the negatives going into their mind. So these are the three things she told, and that is exactly what every psychologist and every psychiatrist do. And a very very I can say a normal person who is not skilled to do this, that person can also talk to a person, such person, and focus on these three things. Other than that, I would like to add few things that
Sure.
what is not to be said, because that is very important for people who are not trained. So there are few things which you should not say or come across while you are talking to a suicidal person. The first and the most foremost thing is, do not ever tell them to that if you attempt to suicide, what your parents will think, what the whole world will think. That will make them more hopeless,
Yeah.
rather than making them more hopeful. So never ever, like, this is a very common practice. Like we just start with this, like ਤੁਹਾਡੇ आपके आपके पेरेंट्स क्या बोलेंगे, आपके फ्रेंड्स और दुनिया क्या सोचेगी. That is not to be done. So this is the most important thing. Second, okay, so somebody just want me to repeat the
Yeah,
three
I think
cutting
should we do
edge.
that by the end? Like we can just give a quick pointer
We will
summary of
summarize.
all of it.
Yeah. So so what not to do, going through that. Second thing, do not compare.
Yeah.
Never ever compare one person with another. Like, don't tell them that, okay, uh, तुम्हारा बड़े भाई की तरफ देखो, वो कितना पॉजिटिव है,
Mm-hmm.
वो कितना काम कर रहा है. That is something to be avoided. Like, if you say that, it will ultimately cause more trouble than helping the person,
And I think
right?
you brought a
So
very true example. This happens. Many of us do think that way कि अरे आपकी फैमिली तो इतनी पॉजिटिव है, आप कैसे ऐसे नेगेटिव सोचने लगे, ऐसा कुछ नहीं होता है. We do that.
yeah, so okay,
Yeah.
professionals are trained, and they have been told repeatedly not to repeat these things. But I'm telling this for the people who are not trained, and they can help someone who is going through this phase of suicide. So they can talk, but not to talk about these two important aspects in their life. Do not compare, and do not tell them that
Right.
what the everyone will think about it. So these two things are absolutely contraindications for a psychotherapy in case of suicide, right? So there are other
Right.
lot of things which can be which should be avoided, that are not absolute but relative contraindications. But these two things are absolute
The most
contraindications in case.
important.
Yeah.
Right. That's true. Beautifully depicted. Beautifully
There's
said. Yeah. Please.
another thing. There is another thing I would like to
Yeah.
ask
Yeah.
you.
Sure.
That is like, okay, how you deal, like how you practically deal with the people who are firm and who are like absolutely not at all listening to anyone, and just sure about that they want to die. Like, there are people who come to us like that,
Mm-hmm.
who are very hurt, or who are impulsive, and who don't even want to reason with us.
Yeah.
So in that case, what do you think, what could be done?
So are you trying to tell about clients who actually are reluctant and just don't want to communicate?
Yes, like would you like them to just put in the room and just lock them
All
just to
right.
save
So
them?
so
Is
what
it
you're
right to
saying
do?
right now, of course, inside my heart, I want to save them in any possible way. That I just don't want them to do what they're planning to do. But we I mean, superficially or physically, we can't do something to put them up and just lock them up. But definitely, we can try talking. Like you're saying, if they're reluctant and don't want to talk, I think a very nice way is to help them express in whichever possible way they want to. I've had clients wherein I have to wait for the entire day, maybe, where they have not spoken, but they do speak at the end. It is just a feeling of you will not listen to me, you are like the others who have tried telling, you are also going to say me all those things which I don't want to listen. I think that is what runs into the client's mind when they are not willing to listen or not even wanting to talk about it, and they have fixed their mind that I am going to attempt suicide. So that time I think what is most important is care, a lot of care. It can be reflected, or the even without speaking. You show that you care. You show that you're here to listen and help them. You show that your and their goal is the same. I think many a times as professionals, we try to sit on the other side of the table, wherein we try to show them that, okay, I'm here to help you. But then, like you're saying, at that point of time, the goals go separate. He or she feels, I don't want to be helped and I just want to attempt suicide. But we at the other end have a goal of making them um, not do the same. So I think coming together and having a similar goal is what is very much needed, wherein we tell them, listen, I am with you and we will work it through whatever you're wanting. Like I told before also, the intention of attempting for suicide is not that I want to die, but it is more about I want to end the pain. So I think again and again reinforcing that we will together try and end the pain will help. Also a very important part here is, like you told about support group, or support, that is social support. Again, they're informing somebody, a caregiver, the family members, the people whom they live with is very essential, because you don't want to risk anybody's life. That goes for mental health professionals as well as for the entire society. If you think you're unable to handle it, just don't go too much into it, and hand over it, or let others know about it, so that you can get more help in turn. I think
Yes.
these, yeah, you would like to add something on it. If somebody's so reluctant, how do we take them forward?
Yeah, there are a few resistant cases with whom you can't just have a word, or who don't want to reason with you, and the talking thing really doesn't help them
Doesn't work.
out of. Yeah, so in that case, like the chemical restraint can be there, as we can't just put the physical restraint on the people. We can just lock them out. So there is something we call chemical restraint in the form of tranquilizers, or some sleeping pills, which can be used for a transient period, so that the person just get ready to talk.
Okay.
And that period is very crucial. But why I asked this, because I actually went through a few cases which were very resistant, and the family members were not ready to get admitted to the hospital or even take medicine.
Oh.
In that case, we lost few patients. So I believe this is another stigma which people have, that psychiatry की मानसिक रोगों की दवाई नहीं खानी है, लग जाएगी, पूरी जिंदगी चलेगी. So in that, only because of that point, some people stop, stop or even not start the medication, and which is very important. At few points it is very important where psychologically, or what we can say, talking therapy is not working. At that point you need. So
Yes.
everybody here, that it is, stop thinking that mental illnesses do not require medicine. बहुत सारे लोग ये सोचते हैं कि दवाइयाँ जरूरी नहीं है, ये एक बात करके ठीक हो सकती है, या मैं खुद ठीक कर सकता हूँ, मुझे किसी असिस्टेंस की जरूरत नहीं है.
Mm-hmm.
स्टॉप थिंकिंग यू आर गोइंग uh, through it really bad, and you yourself will not be able to control it, and the person you are talking to it, that will also will not be able to control it. At that particular moment you need medication. So there is a big role of medication.
That's very true. That's very true. And I'm glad that you're here to, spread information about it, because suicide is uh, usually want to intervene and inform that medicines are also a help that can be provided, which
Yeah.
information is very rarely available, I believe. So like you already told, we usually practice that if somebody comes for talk therapy, and we find out that suicidal thoughts are very, very prominent and very often, it's always good to seek help of a psychiatrist who can provide medical help or medication to that person. And like, I would just like to, re-inform the viewers here that medicines for mental health concerns is not a taboo still, or it is not that they will not help or they will have massive side effects. It's nothing like that. It is something that is for your betterment and can make you more functional. So why not, be more functional? Additionally, psychotherapy and medication together have the best effects. So while you're taking your medicines and now you are resuming to feeling your emotions back and thinking more rationally, psychotherapy or counseling sessions will help you the most at that time to change your thinking patterns, change the way you're thinking and the way you're living. I'm sure Dr.
Yeah. So think we pretty much covered everything, and their audience want to ask anything, or is there any question you got already in your inbox? Like you can tell me, we can discuss on it. Is there any
I think
questions before the?
I had some concern. I couldn't hear you very clearly. The last thing that you told.
Okay, just can you listen to me now? Can you listen to me
Yes,
now?
yes, it's better.
Okay. So
Right, good.
yeah, I was just asking if there were any questions in your inbox or people asked before the session. We
Right,
can discuss on this.
let me open it for questions. So all of you guys who've just joined in or you're there from the middle of this live session, we are having a live session with Dr. Gurjot, who's a psychiatrist, practicing psychiatrist, and I'm Amandeep Kaur, a practicing psychologist from Mumbai with Rebirth by Counseling. And Dr. Gurjot and I are discussing about suicide and suicide prevention. So we had a very healthy discussion on what suicide is, what are the measures to be taken to prevent suicide, or how we as a community can prevent suicide. We also discussed a few things about psychotherapy and medication for suicidal thoughts. With that, I will open up for questions also. If somebody has some question and you really want to talk about it, you can do that here. I'm going to bring upon a few pointers in the beginning that Dr. Gurjot shared. He spoke about how important it is to talk, how important it is to talk and listen to someone who is having suicidal thoughts. And for the one who is having, it's important to share and express what you are feeling. So that is a very big, very important question here. There are lots of people thanking for our conversation here, and they feel that this is the need of the hour. While we are having some questions coming in, the question that I have in my inbox would be is about what do we say to somebody who is telling them about their suicidal thought. So, for example, if I'm going and telling someone I am feeling all of these things, what is the right answer to give, or what is the right action to do?
Yeah, so we are talking about suicidal thoughts here. When the people are having suicidal thoughts, so it's the first step in the process of suicide. So first people start having suicidal thoughts, then they become suicide attempts, and ultimately there is a outcome that is suicide. So when the person is having suicidal thoughts, the first and the foremost thing to be done is to know from where they are coming. So
Okay.
what is the source of those thoughts? Feeling hopeless, why exactly person start feeling that he or she need to end their life? So
Mm-hmm.
the reason itself have the cure. So
Mm-hmm.
if we talk about it, like there can be a different reason for everyone to think about having a attempting a suicide or thinking about suicide. So those different reasons are to be taken individually,
Absolutely.
and a treatment plan should be planned on the basis of that particular reason. So everybody will have a different treatment plan. It's
Right.
not that there is a universal way of doing it, that okay, this is how, these are the 5 steps how you can stop someone from having suicidal thoughts. There is nothing like that. So
Absolutely.
you just need to talk to them. You just need to have the reason You just need to plan according to the reason. If it's a loss of someone who was in their life, and they are not feeling great about it. They are not taking that grief really well, and it is getting complicated. So that need a different approach. In that similar fashion, if it is due to financial crisis, if it is due to job issue, if it is due to some family or marital issue,
Concerns.
the suicidal thoughts can be because the underlying cause is very important.
Yeah.
That is where we. So
Okay.
it is not that you start asking about the cause all of a sudden and directly. That should not be done. So first of all, let the person vent out. Let the person tell their story the way they want to tell. You need not to take it. You need not to just push them to tell what is the reason. What is the reason? That is not the way you should do. So just listen to them. Just let them flow, and with that flow you direct them in a way without asking question. You just direct them to tell their story,
That's, I think,
right?
very important. Yeah.
Yeah.
Anything more you
So
would like to add to this answer?
yes, another thing you need to have is the a very good rapport building. So you should the person who is telling you the story, he or she need to trust you, need to know that privacy and confidentiality is there, so that they can open up,
Yeah.
right? So if it is not there, they will have resistance. They will have uh, they will tell you the things in a different way, in a
Yeah, I
way
think
they
it
look
gets a
nice.
barrier in between the two people when you can't share the entire story then.
Yes, so it is very important to just remove that barrier, just make that resistance, roll over that resistance, and then talk to the person in
Yes.
front of you, so that you can have their reasons, you can have their like. So even the third thing I would like to tell here is it's very simple to do. Like initially, you will not find how to do it, but when you keep on doing it, it is very easy. The
Yeah.
third thing you need to do is simply go with what the person is saying, even if you know that it's wrong, it's she is lying, she is not telling the right thing. Just listen to them and agree. But that is what you need to do, because the first step is to stop the suicidal thoughts, and to stop the suicidal thoughts you need to affirm them that you are having help, you are being listened. So the point, the moment they realize that, okay, I'm not alone, there is someone who is helping me, okay, I will be out of this, the thoughts will reduce smartly,
Agreed. Totally agreed. When
right?
they see it like a dark room wherein there is nobody to help me out, and then with a little bit of hope, they talk to someone, and that person is ready to listen, ready to agree to all that they are saying. I think that opens up the door to hope. And I think hope is something that we all want to bring more, as there is a lot of hopelessness already.
Right. So we were talking about more professional thing, and I think our viewers want to know how a layman or a non-trained professional can
Yes.
help people
Yes.
at their home, or at in the society where they can. So yeah, so to start this topic, I first of all, I will congratulate these people who are asking this, because most of the people just think जैसे पंजाब में ऐसे होता है कि कहीं एक्सीडेंट हो गया तो किसी को हेल्प भी मत करो, क्यों ना करो कि पुलिस वाले क्वेश्चन पूछेंगे, और you in problem
That's right.
ultimately.
Yeah.
In the same situation, people don't want to get into this
Involved.
suicidal thing. Yeah, they don't want to get involved, they just don't want to know. Why they don't want to know? If somebody just go through suicide, and then people will ask questions that you must be knowing something because you were talking, and that ultimately, so that is one thing which actually stop people from helping who are having suicidal thoughts, right? So this is the first thing I would like to tell. I would like to congratulate those people who are actually trying to help those who are having suicidal thoughts. Secondly, how to
Right.
help. So we already discussed this. in a very brief, like we can go into details, but details will be like we will have a very long session then.
True,
But
true.
coming to a in short, if I tell you simply, like ma'am told, listen, just listen, just try to make that person realize that okay, I am having someone to talk to.
Yeah.
That's all you need to do. All the manipulations, all the directions, and all the flow, change of flow from suicidal thought to a positivity, that thing cannot be done at home.
Mm-hmm.
To be practical, that is not possible. Because why that is not possible? First of all, the person you are talking to, he or she is is your friend or somebody you know. So they have a lot of resistance to talk to you. They will not, they really don't want to tell you everything, right? So you, when they go to professional, they have a person who is stranger, who is professional, whom they can trust, and with the confidentiality and privacy. So what can be done at a professional end, that can only be done at a professional end. So what you people, you guys can do at home is simply talk to that person, simply go with the flow, simply just listen to them what they
Mm-hmm.
have to say, and make them realize that they are not alone. That is all you need to do.
Yeah.
And keep them open. Tell them that you are here for them, and whenever she feels negative, whenever she feels down, or she feels like going for suicide, you are available by call, in person, any method.
Right.
That's all you can do. That is a big step. And believe me, I think 100 on 100 can be 100 on 100 suicides can be delayed and pushed back by doing this
Correct.
very simple thing,
Very true. I think
right?
you've given a small tip, but it's such a big tip and such an important one. Why is suicide considered such a tragic event? It's because it is preventable. It's because we know we could have done something to prevent this. So, like Komal Pitawa here has asked the question, and that question that you answered, which says that how to provide support to someone who is suicidal and under the use of medication. So, like Dr. Gurjot already told, a professional help, if given, if is required, then must be given, and that a professional can only do. But as a support or as a person who is there for as a family friend or a friend, you can just be around and help them or tell them that you're available one call away. I also would like to add in here that if sometimes you know you are not available and you cannot be there, it's better to provide them with some hotlines, some helplines which are readily accessible. There are some 24/7 helplines available for. We can, upload that in different pages or our Instagram and Facebook profile also of Rebirth by Counseling, wherein they can approach a mental health professional through those helplines. It becomes very easy to approach over a call. Also, they are readily available. Also, they are good listeners, and that will actually, give us the right uh, place to vent out. A person will be helped very easily that way. Yeah, should we take the
Okay, so
next question then?
yeah, there
Okay,
is another question. uh, okay, I have to we will summarize this after this question. We have to summarize this session because I have to go for rounds, and
sure.
I'm already late,
Sure,
a little
yeah, we
late.
have exceeded as our
I
viewers
will,
are showing a lot of interest. But
yeah.
we have a question of how spiritual leaders can help the ones who are suicidal. So, how can we
Yes,
really, as having spiritual? Actually, India is very, very overpowered, or a very big influence is of the of the spiritual leaders. So, how can they help?
yeah. So it's a two-way sport. I can say that spirituality, uh, like uh, like if we see, there are a few cases of suicide where the caste and the religion and these kind of things actually leads to suicide and the problems in the people's life. But on the other hand, if these things are used in a positive manner, in
Mm-hmm.
a helpful manner, they can actually resolve various issues. And this is a very strong thing. This spirituality is a very strong thing. Why it is strong thing? Because you have someone who is not even if not available in person with you, you have someone that is God, and the spiritual being whomsoever you believe in, that he or she is present all the time with you. You can just rely on someone who is not physically present. So what I want to say is if we direct the people to follow the spiritual text, and people who promote the spiritual text. So what exactly they get is they have a rational, they have
Mm-hmm.
rational to their problem. They can tell that okay, ये भगवान की करनी है, या they can also say that भगवान मेरे साथ है. This statement is not very small statement. Like that is someone with you 24/7. And people who really have faith and believe, they can use this as a way to feel not alone, and actually uh, put their problems away to someone whom they believe and have faith that supreme power can handle it. So it is actually very helpful.
Right.
How it can be done, it can be done just by uh, connecting the people with their appropriate faiths, and appropriate whatsoever they believe in. Just connect with them, and they need to be realized that okay, uh, you have someone, some supreme power all the time with you, and who is capable of helping you out,
Right. And
right?
like you
So
told, connecting them to the faith, very important.
yes. So that is very, very simple and easy way, where non-professional help is not, where professional help is not available, and spiritual help is available. So people can just direct them for a brief period of time, to delay things, to make them relax, so that they can be connected ultimately to the professional help.
Right. So, like, until they can reach out to professional help, to delay, like you told, to actually, that is a very big step of prevention. Many a times when we prevent the first attempt, it's usually prevented for a longer time then. So, of course, relapse is something that can happen anytime. But yeah, till the time you reach to a mental health professional, till the time you start medication, this is a very good option to resort to because it is readily available also. Fine. Dr. Gurjot, would you like to add in anything? I know we have taken a lot of time of yours. There are a few more questions which we can probably answer through texting them back.
Yeah,
And I think
I,
your
I
time is
can
also
see.
running.
Yeah, I can see another question. Mohit Rathod is having a question, and this question I would love to answer this
I
question,
know.
and it's something, it's something which needs time, but this question needs a lot of detail. It's not just a situation, it's a circumstance, it's a different, we can say, if we talk about psychological aspects, it's altogether a different disorder, and this different solution based thing which we are talking about. That if somebody is in a bad space, like mostly women are in that situation and scenario in this Indian setup, where they are not able to get out of their families, and where they are tortured, and they are uh, just stuck there, and they can't really do anything about it, and that ultimately leads to this suicidal thoughts, and depression. So we will have a session about
Yeah,
it in
true,
the near
true. We
future, and
should. And we'll also reply
we'll
on this comment of Mohit Rathod. And that's a very thoughtful question that he has asked, which brings a whole lot of new topic to discuss about. Right. We have
yes.
some more questions coming in, but I think it's time that we, stop the live session. Even Saket, we will be answering you too through this message. I think, is it okay if we wrap up then, Dr. Gurjot?
Yeah, Yeah, so this question of Saket is very important question. How to decide you need a psychiatrist or a psychologist? Uh, the simple answer is you need both in everything. It's not these two are not separate. Like if you go to a psychologist and psychologist assess you and he or she feels that you need a psychiatrist, you have to just see a psychiatrist and vice versa. Other thing is psychiatrist is required only when the disease has set in. When you are in a situation where the disease has already been being into your brain and mind, and you are not able to function well, you are not able to think properly, so you need some assistance in the form of medicines. So that's where psychiatrist is required. The other thing where psychiatrist is required is the diagnosis. Sometimes it's like many medical issues like thyroid problem, or we can say some hormonal disturbances, and even the anemia itself can cause some psychological issues which can be missed if you directly go to psychologist. So going to a doctor is simply just to get a diagnosis. Treatment part is all about psychologist. And why I'm saying that, because I have gone through few patients which were taking, or taking this psychology sessions from quite long time and not getting better, and ultimately they had some physical issue in the form of some thyroid hypothyroidism,
Oh,
or some hormonal imbalance, and ultimately they got the treatment, and
better.
uh, their other symptoms also got better. So so it is very important. So I think going to anyone is fine, because if it's just one visit. If you go to psychiatrist, they will lead you to psychologist if you are fine, if you don't need any medication. And if you go to a psychologist and she finds that there is some trouble, there is something wrong other than just your thoughts and emotions, he or she will direct you to the psychiatrist.
Correct.
So
I think I totally
let's say,
agree. The roles run that way, and both of it is important, like he told. Diagnosis is also sometimes really important, but when you have some day-to-day stressors which are unable to, let you function properly, I think approaching a psychologist first is what you can do. But if you think you're undergoing something which is very, very major, and you're unable to just control, there is no control left in your hand, you must visit a psychiatrist. Also, there is a lot of taboo when a psychologist refers to a psychiatrist. People are, they feel withdrawn. They say, no, I don't want to go for medicines. That's why I'm here. So, to all of those people, we have discussed this before, but medicines are nothing but a way to change the chemical reactions that are moving inside. Also, your neurotransmitters need to have the correct functioning or the level of functioning for which medicines are taken. So medicine and psychotherapy together gives the best results for any mental illness, including though suicide is not an illness, but still it sometimes really requires medication too.
yes.
Right. So I think
So it
with
was.
that, we had a very healthy discussion. I'm really again thankful to you, Dr. Gurjot. I would like to inform that Rebirth by Counseling is doing a very hard and a very um, a good work into providing therapy easily at your fingertips. Because with this change in the environment and the change in the entire, because of the pandemic, also online therapy has come into existence, and it is easy, quick, and accessible. So Rebirth by Counseling has a lot of psychologists, trained psychologists and psychiatrists who can help you online for your concerns. The time slots are given, it's very easily accessible and also very cost effective. So like you already told, and sometimes it is difficult for people to reach out to a professional. I think this is the right channel. Online therapy can be really useful if you are having doubts about reaching out to a professional in your local area. With that, I would like to end here. Anything else that you would like to add, Dr. Gurjot?
Thank you very much for this opportunity to interact with so many people, and the this platform, giving me this platform where I can just express my views about the society, which is the need of the hour. And you guys are doing absolutely great work at Rebirth by
Thank
Counseling, and
you.
I believe these kind of platforms need appreciation, and they are connecting really well with the people who are not that comfortable to talk to the professionals in person, and having some shyness in approaching them.
Yes, yes.
So it's completely online. You can just go to your phone, your laptop, and in a closed room at your home, you can just talk to professionals and get out of your uh, all the darkness and all the so I felt great about it, and we will. I would look forward to have more such sessions,
True.
and all in different languages. We can have exclusive Punjabi session, which is very close to my heart, and because I really I would like to tell that there is an organization working free of cost, non-profit organization, which is called Rabat,
Mm-hmm.
RAAT. It is there on Insta as well as on this. Facebook, and what we are doing there is we are providing information about psychiatric illnesses and psychiatric disorders in local language, that is Punjabi. So
Oh,
we
wow.
we are having these slides of same thing in the English language and then Punjabi language, so
Okay.
that people who are not that educated and who only know the local language, they can actually know about the illnesses.
I think that's a
So that
marvelous
is,
job because mental illnesses don't knock the doors of economic looking at the economic status. It is for everyone. It is a thing that can happen to anybody at any time. So educating those who are, not very comfortable with the languages that we usually speak in is an absolutely good initiative. And I totally agree to what you told. We should have sessions probably in Punjabi, Hindi. Maybe we can call upon someone for different regional languages too. So all the viewers
yeah,
also be stay tuned and follow and like this page because we'll be having more such live sessions, and we'll be calling out some more speakers. We'll have Dr. Gurjot also again to talk about various other issues that are pressing mental health concerns. Right.
yeah.
With that, I
The,
think, yeah. Sorry, would you like to add something?
yeah, thank you very much, and I have to go now. And
Yes, sure.
thank you for great session.
Thanks a
Great
lot for
session.
this lovely time that you have. Thank you, everyone. Thank you, all the viewers. Bye bye. Take care and have a good evening. Bye.